So, in the last session we have actually looked into the EEG signal, and for that EEG signal the point of attack was we are targeting the QRS complex, and if you can find out the QRS complex, or to be more specific the R wave, then with respect to that we can actually find out that the other waves. So, that is the way that ECG signal is actually analyzed. So, today we will now look for the EEG signal or electroencephalogram. So, the common type of the EEG, that is alpha, beta, theta and delta. Let us have a recap on that, that we get that the bandwidth is 0.1 to 100 hertz. So, that is very similar to the ECG, but if we look at the magnitude is much less than the ECG signal, it is 2 to 200 microvolt. Now, because that voltage is less, so we need to be more careful about removal of artifacts, and when we look at these signals, these signals are primarily they are random signals, or in other words that we hardly can find any shape in these waves, these alpha, beta, theta, delta. So, the way they are described is in terms of actually the frequency band, because none of them they are actually monotone signal, they do not give any discrete frequency. We get the energy of the signal is actually dominant in some actually that range. So, depending on that we define some band of frequencies, the lowest band that 0.5 to 4 hertz, that is for the delta, then 4 to 8 hertz, that is for the theta, and alpha starts from 8 hertz and that ends at 13 hertz, then beta starts from 13 and ends at 22 hertz, and gamma starts from 22 goes up to 30 hertz. Now, each of these wave delta, theta, alpha, beta, gamma, they are actually predominant at different kind of normal conditions. Delta is common in deep sleep, the theta will get when the people are sleeping, but not in deep sleep. The normal awake condition, that the people are relaxed and awake, in that case we will get alpha, and we will get beta when the brain is active, and gamma is for higher mental activity visualization. We are trying to conceptualize the thing in that kind of scenario, and at the same time this nature can change, that at different kind of abnormalities or pathogenic conditions also you may get some of these waves. For example, if you have a lesion, a person has a lesion developed, that means a tumor has developed in the brain, then in that part even that person when he is awake, maybe relaxed or at activity, will still may get delta wave in the nearby region. So, that can help us actually to diagnose and localize also that where is the tumor is located. Again, that if the person is in depression, then we can get theta wave even if that person is not in sleep. He may be awake or doing some activity, but because of depression we may get the theta wave. Okay. So, that is the general description. So, the first thing what we notice in case of EEG signal, that the descriptions are based on the frequency band, because all these signals are random in nature and you cannot quantify them as a shape based actually description like we could get for P, QRS and T wave. Okay. So, that is the main difference. However, it does not mean that there are no waves with shape, and now we will go for that description of it, that apart from these, that what are the things are present which have some shape. So, for the EEG rhythms, first we will look at the K complex. this K complex occurs spontaneously in response to sudden stimulus or during the sleep. And if you look at that, what is the magnitude of the signal, that it is 200 microvolt. So, comparing that magnitude of that EEG signal, it has good magnitude, and this wave is a slow wave. Okay. So, evolution is very slow, and sometimes it is associated with some sharp component, and after that we get actually that 14 Hertz wave. Okay. So, that is the peculiarity of the K wave. So, here we get some description that someone is at sleep, or actually when some stimulus is given, or when awake also, that we get the K complex, and after that 14 Hertz means that person is awake and the brain gets busy kind of thing. Okay. So, after that that person becomes awake certainly. So, and if you look at that, we see that it has sufficient magnitude, and it is a very slow wave compared to that both the sides the EEG waves. Okay. So, that is the typical characteristics of that K complex. Now, let us look for one more. Let us look for the lambda wave. The lambda wave, it could be monophasic positive sharp wave occurring at occipital lobe. Okay. So, first let us look at that what is occipital lobe. That this is the region of the occipital lobe, this part we have marked with occipital lobe, that means at the back of the brain, and that in this region if we put the electrode and we take that. So, here we look at the next wave, that is the lambda wave. It is a monophasic positive sharp wave occurring at the occipital region. Okay. So, here we see the occipital region, it is the back of the brain. If we put some electrode there, so what will happen in that case, that we may get this kind of lambda wave. Okay. And these lambda wave are monophasic, that means it could have it should have one peak, it is positive and sharp, and however, the magnitude is less than 50 microvolt, that means that magnitude is much less than the K complex, and it is associated with the eye movement or that other visual exploration. That means some work is going on that is related to the visual activity. So, here we show that the lambda wave, that we get the lambda wave, and we get an idea also that how the amplitude actually changes, that with respect to the wave that is present at that time. So, that is another wave which has a particular shape or shape based description. Now, let us look at that mu rhythm. In case of mu rhythm, the frequency range, it is between 7 to 11 Hertz, and amplitude is less than 50 microvolt. Okay. So, amplitude wise, if you look at that, it is similar to the previous one, and however, it is a repetitive kind of thing, that there is a unlike that it is not a single actually wave. Now, in this case the shape is looks like a wicket with sharp tip and rounded base. Okay. That if you look at this part, that we get that nature here, that sharp tip and rounded base. However, what may happen that these things can be actually we can get just the opposite, because when we are taking that bipolar actually that recording, if that terminals are changed, we may get just the opposite. That means, below we get the sharp spikes and the upper part that is rounded. Okay. And blocked or attenuated by the contralateral movement or thought of movement. So, it is associated with the movement or thought of movement. Okay. This mu wave comes for a certain kind of situation when we are thinking about the movement or we are moving really. Okay. At that time we can get this kind of wave, and again mu rhythm is something which is described by the shape of the wave. Now, the next one we look, we get the spike. The spike is a transient which is a pointed peak and duration in the range of 20 to 30 millisecond, and almost similar description is there for the sharp wave. These are they are the transients with pointed peak, and duration is however is much bigger, 70 to 200 microsecond. So, what we get actually that compared to the spike and the sharp wave, the difference is the sharp waves the width is 3 to 10 times. Now, that is the difference. Now, what is the importance of the spike? That we know the people have, some people suffers from epilepsy, they become unconscious all of a sudden. For them, what is found that this actually the occurrence of this is associated with some spikes in the EEG signal. Okay. So, if in the EEG recording you get the spikes, then that could be taken as a precursor of such kind of epileptic attack. Okay. So, they are important to actually monitor, and they have actually lot of clinical significance. Next, we get the spike and wave rhythm, a sequence of surface negative, that is in the range of 2.5 to 3.5 hertz, and however, the amplitude could be much bigger, up to 1000 microvolt. 1000 microvolt means about a millivolt, that kind of actually that spike, and that is associated with each wave. So, one spike would be there, one slow wave will be there. Slow wave is having a very low frequency 2.5 to 3.5 hertz, and the spike has a large actually that amplitude. And this kind of rhythm, if it is associated with multiple spike, then we call it polyspike and wave. Okay. Usually one spike would be there, but if we get multiple of them together, so that is called as polyspike. So, here we get some example of spike and wave, that we get here the the spike followed by the wave, and again the same repetition is going on. In a very similar way, we can have that polyspike and wave. Okay. So, that the spike is predominant, that is because of its amplitude, and we cannot miss the following the low frequency wave also, because it has some shape. So, that is why it got a separate existence, unlike that that delta or theta wave. Okay. So, that makes it actually different from those that predominant waves. Now, let us look at next, we look at the vortex sharp transient or V wave. In case of V wave, that let us look at some example that why the name has come. It looks like a actually V. So, it could be the positive V that, or it could be inverted V depending on that the configuration that the how the that leads are connected for the recording, and it has a sharp actually change in potential up to magnitude 300 microvolt. So, 300 microvolt means it is actually bigger than the usual magnitude of the that EEG signal, and it occurs spontaneously during the sleep or in response to a stimulus during sleep or wakefulness. So, during the sleep it comes spontaneously, and it can also be found in response to a stimulus when the person is sleeping or awake. So, both is possible, and we get that a particular actually that amount of that the magnitude of this wave and a particular shape with respect to that actually we have defined this wave as a vortex sharp transient or V wave. Now, we get another that wave that is called sleep spindle, and it occurs in a particular region called frontocentral region. Okay. That means, the front part of the brain that that part will we can expect to get that from those leads, not everywhere, and that it gives a burst of brain activity. Okay. Suddenly, there is a actually huge change in the signal, a lot of actually waves are coming as if the activity has increased in the brain. So, as we get here in this place that sleep spindle, and it comes in the stage 2 sleep. We know that there are 4 stages of sleep, that that non rapid eye movement sleep, and there is rapid eye movement sleep. So, it comes in the stage 2, that means the first stage that when the person is going for sleep, and now when in the first stage actually he gets into the sleep and comes out, and in the next stage the stage that it is becoming little deep. So, in that stage this sleep spindle comes, and we get that a quantification of that it comes within this range 12 to 16 hertz, and it has a cap on the magnitude also, that is 50 microvolt, and there is a temporal window that how long it can occur. It is in between 1 to 1.5 seconds. Okay. So, there is some localization in terms of that where we can get it, that frontocentral region of the brain, and we get it in the that as a time we get it in stage 2 sleep, that, and what we get that the description of the wave that now comes, that it is in between 12 to 16 hertz should be the predominant energy, and if we look at the amplitude it would be about 50 microvolt, and that the span of these would be 0.5 to 1.5 second. So, that gives us some idea about this signal. Now, let us look at that how the whole thing is actually described. When the EEG recording takes place, there is a certain way that reporting is done depending on their importance. The first thing that is actually given is what is the predominant wave. For example, that when the recording is done, if that person is awake and relaxed, then we are supposed to get the alpha wave. So, that would be the first description. Now, the person lying on the bed and we are collecting the data, that person may get into the sleep and or light sleep kind of thing, and again becoming awake as the instructions are given. So, there could be presence of other rhythm, okay, or that person could become busy in thinking some other problem, that the patient means that he is like any other normal person and he has other duties. So, while physically at rest, that person may think about the responsibilities, what are the duties he has to discharge after this session. So, other waves also may come in. For example, if he gets into the sleep or feels sleepy, then theta wave may come. If that person actually thinks about his other work, then it may go towards beta. So, there are a contamination we can say along with that alpha wave. So, these are the first two points actually need to be given. Next, we should talk about the discrete features of long duration. Okay. So, when we get now first two, if we look at, they are frequency based, these are actually frequency based descriptions we would say. Next, we look for that the shape based one. The first among them would be the long duration one. If we have a spike and wave activity, so that long duration discrete feature that should be mentioned, followed by if there is any discrete features of short duration. Okay. So, like spike or sharp wave or V wave. So, these are the things we can talk about. Okay. Then that apart from these, if we have any other that observation, such activities, so that can be told about the activities when all the previous features are described as background. If there are special any other change, like we told that in case of a person having a brain tumor, in that location we may get that delta wave even if the person is awake and maybe that in relaxation or actually having any mental task. So, in that case that could be a description which would come here. So, first is frequency based description. So, the first one is actually a must, then all the other things are actually optional based on their occurrence, that if there is any that mix we should tell that. Then we talk about these two, that is long duration and the short duration, the wave description, that is shape based one. Then keeping these things as a background, we are talking about any special occurrences of EEG, any special observations what we have made. So, that need to be reported, and at the end we should talk about the artifacts that is present. Why we should mention about the artifacts, that actually talks about that what is the risk we run for taking this actually measurement. Okay. That when we are analyzing these things or taking the doctor is taking a subjective actually judgment about the waves, then these artifacts are actually coming in the way. So, if any artifact is present, that need to be mentioned. So, we get that how good actually this signal can be analyzed and used for this purpose. So, this is the short description about the EEG signals, which will help us to go for the next stage, that is how to identify some of them which is required for the reporting of EEG. Thank you.